Hello, everybody. It's Dr. Alfonso coming to you from the Bengtson Center for Aesthetics and Plastic Surgery and new Vista Surgical Suites. I hope everyone's doing well and enjoying the beautiful fall weather that we have. Today is part of our All That Glows week. I'm hosting a Q&A session that will discuss and answer questions regarding to the number of surgical procedures that we offer here for our patients in terms of surgeries, as well as some questions that patients may have about recovery. That's always a big factor when patients are looking at having a surgery. How is this going to affect my recovery, both my return to work, but my return to normal activities, and even my return to exercise? So those will be likely addressed today as well. In addition, again, to remind patients that we are up and open in person. We're happy to see you in person. If patients feel more comfortable doing a virtual consultation, we are also offering that, as we have been over the past few months for patients who are either out of town or just not comfortable yet coming in person. Our staff here has done an incredible job since we've been open for about the past 4 months of abiding by all of the guidelines for social distancing and mask wearing. So we've done our best to create as safe an environment as possible. However, we know that for some patients, they may feel more comfortable doing a virtual consultation, and we also have that ability as well. Some of the things that are unique about our practice that I've talked about in the past, but I'd like to remind people about, revolve around the recovery and some of the things that we do to help with that, specifically related to some of the bigger surgeries like an abdominoplasty. The technique of abdominoplasty has changed quite a bit over the years. It's also referred to as a tummy tuck. But one of the great things that we offer here from our anesthesia providers for patients is called a tap block. And the tap block is really important for patients because it allows them to recover in a much quicker fashion. The pain that used to be associated with an abdominoplasty is very diminished compared to the pain that patients have in the past. So it allows them to get up and walk in a quicker, allows them to resume normal functions better. And it's a procedure that's performed by our anesthesia staff in the operating room while patients are asleep. And that uses an ultrasound to allow imaging of the nerves of the muscle layer. And a long-acting local anesthetic is injected into that layer, which lasts probably about 2.5 to 3 days in most patients. And it gives significant pain relief that we couldn't achieve before the advent of that technology. So I'm happy to talk to patients more about that if it comes up on the Q&A or in regards to their consultations. When a patient schedules and comes for a consultation, whether it's virtual or in person, we spend quite a bit of time in discussing all of the aspects of surgery, both the pros and as well as the risks associated with various surgical procedures. And they really, we feel like we give a great amount of education for the patients without overwhelming them, but really emphasizing the important aspects of the procedure. So I hope that that aspect of things has been helpful. And those are just one of the many things that I like to promote for patients in regards to the recovery and some of the technology that we use here in order to make your recovery and your experience that much better. What I like to do is allow patients, if they have any questions, I will be available for the Q&A session. If they have the chat function, they can send over some questions via the chat function. And as they come up, I will be happy to answer them in regards to any questions that may arise regarding surgery and recovery. Some of the other things that I'd like to chat about revolve around the non-surgical side of things. We certainly offer a lot of non-surgical technologies, from Botox and injectable fillers to a non-invasive facial contouring. Those are all available for patients to find more about. Everything is on the website. And also, if someone would like to schedule a consultation in person, that can be obviously a very effective way to gain the knowledge about the procedure and how it could be ultimately what would be ideal for certain patients. So I have a first question here I'd like to read is, what options are available for patients who've had a number of abdominal surgeries and tummy tuck would not be an option, but possibly lipo? Well, the difference between doing a tummy tuck and doing liposuction revolves around skin quality. And that's a really important fact that patients often don't realize, that you have to have good skin quality to do liposuction because no skin is removed during that procedure. And what happens is the fat is removed, and then the tissue then kind of shrink wraps back to the deeper tissues to give a good shape. Now, if patients have loose skin, if you've had multiple pregnancies, or weight gain and weight loss, or abdominal scars with extra skin, sometimes the best option for that patient is to do some form of an abdominoplasty or tummy tuck. It could be a modified tummy tuck or a traditional full tummy tuck. Um, the scarring can influence what sometimes we can do as surgeons. If patients have quite a bit of scars on their abdominal area from previous surgical procedures, it may impact the ability to do a full abdominoplasty, but almost always we can do either a modified or a mini abdominoplasty to help with that. That often can be combined as well with liposuction. So really the physical exam is the key component to determine what procedure is optimal and best for patients. And that is what we do here when you're in our office during the consultation, determine how good your skin quality is, and are you a candidate for a procedure that is less invasive, such as liposuction, or something that needs to be a little bit more involved, such as an abdominoplasty, which involves tightening of the deeper muscle layer in many patients, as well as removing skin. So the key is, as I always tell patients, is picking the right surgery for you based upon your anatomy and your tissues, not what you want to have because it may be the cheaper route or the easier route from a recovery, but what is going to give the patient the best result, which ultimately is what we want to accomplish. Thanks for the question. Oftentimes questions do revolve around the candidates being like, am I a candidate for this surgery or that surgery? That can be a difficult one to answer. Again, that's why the consultation is so important for that. It looks like there's another question here. Dr. A, what surgery would you consider to be your specialty? Well, my specialty really revolves around body contouring, which is sort of a generic term for liposuction as well as skin removal, both on the arms, the trunk, as well as like with abdominoplasties, as well as thigh and buttock area. And we've seen quite a bit of an uptick in the interest in contouring of the buttock area, both with injecting fat to help round out the buttock area, as well as performing buttock lifts, which actually brings tissue that may have dropped down over time to a higher level and lifting it up with the surgical procedure in terms of that. So I would say 75 to 80% of my surgical procedures revolve breast and body, and then the other, let's say 20 to 25% to 30% are facial cosmetic procedures. It helps to do a variety of surgeries. It keeps life interesting. It keeps my surgical skills up, and I really do have a passion for helping patients achieve their body contouring goals regarding their procedures, especially for those patients that we see quite often who have lost a significant amount of weight, either through diet and exercise or with previous surgical procedures. Another question here that popped up, how do we go about scheduling a consultation? Well, you can call our office, and that's the easiest way to do it. And our phone number is 616-588-8880. A member of our First Impressions team will be able to chat with you and discuss what surgical procedures you're interested in, and if you don't know, or more or less what areas of your body are concerning, and then they can talk to you about options for scheduling, either with Dr. Bengtson or myself, based upon your schedule and our availability and the procedure being performed. We're looking in the future to have online scheduling, which would be a really neat feature, and we're working towards that goal, hopefully in the near future, where all of the scheduling can be performed by the click of a button on your mobile phone or a laptop computer. But now the best way is to call our office, and somebody will reach out and chat with you while you call and be able to look for a time to get you scheduled. We do have a consultation fee that is charged for the consultation, and the consultations typically run about 50 minutes to an hour, sometimes a little more, sometimes a little less, depending on the procedure that you might be interested in and how much we need to talk about that. But we definitely don't want to don't want to rush the process. We want you to feel comfortable and educated and know that you're in good hands and ready to move forward. Here's another question. How do you, as the surgeon, help a patient decide between a breast lift or a breast augmentation? So oftentimes those procedures are done together, where the patients come in and they say, I would like a breast lift, but they've lost a lot of the volume that they once had prior to pregnancy and breastfeeding. So patients can do breast augmentation as a standalone procedure. Patients can do breast lift as a standalone procedure, and patients sometimes can do a combination one, which is a breast lift with an implant. And it really depends on how much breast tissue that you have left over from your previous physical state before weight gain, weight loss, and pregnancy and breastfeeding. In addition, it depends on what your goals are, how full and round you want to be. Oftentimes, the combination of implant and lifting is very effective because it does twofold improvement. It allows more volume to the breast by using an implant, and it allows the surgeon to lift the tissue, lift the nipple up, and get the breast into a more perky and lifted position on the chest wall. So oftentimes the surgery is combined. In some patients, they are more interested in just having their own tissue used and lifted and reshaped, and that's fine as well. It's called just a simple breast lift without a implant. And the scar for that typically involves a scar around the areola, kind of like a circle that would be going around the areola and then down, kind of like a lollipop scar. So if you've heard that term lollipop scar, that's typically what it refers to. And that is used whether or not you use an implant with a lift or you do a lift by itself. For breast augmentation, if you're only doing breast augmentation because you don't need a lift, the scar is placed under the breast crease, kind of in this fold area here, and it's about that long and allows the surgeon to make a nice position or a pocket for the implant and place it with as minimal trauma to the tissue as possible. So the scar pattern and the recovery all depend on the type of procedure, but overall, patients can be a candidate for one of three options: breast implants alone, breast lift alone, or a combination procedure called augmentation mastopexy. That is a question we hear a lot, and that's a great question. So one of the things I also wanted to talk about that patients may or may not be aware that we offer here is a procedure called NeoGraft. And NeoGraft is a hair rejuvenation procedure which has been very, very effective. And I actually had the procedure done about 9 months ago. And the benefit of that is that it is a much quicker recovery than older hair procedures. The way it is performed is very small hairs are removed from the back of patient's hair head in the back part here. Those hairs tend to be much more resistant to the changes in hormones that lead hairs to fall out towards the front. Those hairs are then removed one by one and with a special robotic assistance so that the consistency of the hairs is very, very good. And then those hairs are then placed in the front of the hairline depending on what area needs to be enhanced. The benefit for this is that those hairs then will ultimately regrow and allow for a thicker, more dense collection of hairs in that area. The most common areas that we tend to fill are what we call the temporal area here and here, as well as the front and then the top of the head. This procedure can be done for both men and women, as women oftentimes will have areas of balding that has become very self-conscious, and it can be an effective procedure for them as well. So the NeoGraft procedure is also combined with some non-surgical medical treatments that we perform. One is called the Caravive, which is a hydrofacial type procedure that is performed to help stimulate the scalp and blood supply and growth factors into the scalp. That would be done before the procedure as well as then months after. In addition, we have other medications that we get patients on prior to surgery as well as afterwards in order to help with the growth phase of the hairs. When hairs are transplanted, they grow for about 6 weeks or so, and then they kind of go into a quiet sleeping phase, and then part of the hairs will fall out. And then in about 4 to 6 months, they start to grow back in a much more robust fashion. And that's when patients start to see the improvement in the hairline and the thickness. So if that's something that you might find interesting, if you've been concerned with some hair loss and hair thinning, the NeoGraft procedure could be an excellent one. I had the procedure done on a Friday, and I went back to work on a Monday. Luckily, I work in an operating room setting, so I can wear a surgical cap to kind of camouflage it. But there is some downtime in that regard, but patients generally feel very good early on after the procedure. Another question came up: is there a certain amount of time that someone should consider getting implants switched out? And the answer to that question is pretty simple, and there's no set time. The longer that implants are in your body, the higher the likelihood each year that there's a potential that they might rupture or leak. And sometimes patients will notice that if it's a saline implant or a saltwater implant, if the implant ruptures or leaks, then what happens is the breast will change in shape and size, kind of like a balloon that's deflating, because that's pretty much in essence what's going on. The salt water that is contained in that saline implant then is absorbed by the body, and typically women will notice that one side looks significantly different. And then we recommend surgery to replace those implants. For the silicone gel implant, which is by far our most common type of implant, the timing is really based more on any issues or concerns that you may have. Current implants that we're on now are closer to the 6th to 7th generation of implants, typically have a lifespan somewhere between 17 to 20 some years. And so the patients, it's not something that patients need to be checking every day to make sure the implant feels okay. With silicone gel implants, most patients aren't even aware if they have a small leak or rupture in the shell, and that in and of itself is not a health risk to patients. It sometimes takes a while for them to develop any kind of change to the breast, which would then allow us to do some imaging studies. One of the many benefits of breast surgery here at our office is the fact that we use high resolution ultrasound. The high resolution ultrasound can be used right here in our room with patients wide awake to examine their breast implants and get a better sense if there is some disruption to the shell of the implant. That would prompt us to consider then ordering a more formal test like an MRI to determine whether or not our implant is ruptured. If it is ruptured, we do recommend removing and replacing them if that's what patients want, which the majority of the patients do. It's not an emergency and doesn't have to be done right away, but typically we recommend it being done at least within 2 to 3 months so that the implant itself doesn't allow any more leakage of the silicone. Again, silicone is contained in the capsule layer, which forms around the implant. That's the normal layer of tissue that's formed. And the silicone does not leak into your other parts of the body. It's contained and walled off. But nevertheless, we do recommend that they be replaced in a relatively expedient time frame. And the procedure to replace them is relatively easy from a recovery perspective. Typically, because the implant, the pocket has already been made, the muscle's been lifted, so it's very minimal downtime and pain. So that's typically what I say. Oftentimes patients will say, well, I heard that every 10 years you have to get them replaced. Really, the answer is no. If everything looks fine, feels fine, you have no concerns, and you feel fine, and everything looks good on all your imaging studies, then there really is no set time frame where you would have to take out perfectly good implants and replace them if you were happy with the procedure. If you want to discuss changing because you want smaller implants or larger implants, that can be done at any time. However, from a perspective of implant lifespan, again, typically with this generation, 17 to 20 years is typically the time frame that we're quoting for patients. Do we have any other questions from our attendees to the Q&A session? I'd be happy to answer them. Also, there are opportunities to email questions in that can be forwarded to us if a question comes up at a time frame that's not during one of the webinar or educational series. Again, I definitely want to recommend patients check out the website for All That Glows. We're having a 2-week skincare kind of special at our offices. There's great deals on non-surgical products as well as skincare and injectables. And again, encourage patients, if they've been considering or thinking about taking that next step to learning more about a surgical procedure, which may be their goal, to reach out and schedule a consultation. We'll be happy to meet with patients and to discuss the concerns that you have and then formulate a plan for your surgery. Here's another question. Do you recommend losing weight before liposuction or a tummy tuck, or be at a certain BMI? That's a great question because generally speaking, yes. If you have a goal in mind and if your weight loss exceeds 15 pounds of what you want to lose, then we would typically say lose the weight before considering doing surgery because the result will be much better. Typically speaking, BMI of anything over 35, depending on the surgery, would become a little bit more concerned with. Again, it's more surgery specific. But as you get up into the higher level BMIs, if you're into the high 40s, that becomes much more concerning from a recovery point of view and complications. So we generally like to have patients anywhere from 15 or so pounds of variation of their ideal body weight before undergoing a procedure, because if there is significant weight loss or weight gain afterwards, that could affect the result. And we want to have patients who are typically at a stable weight for approximately 6 to 8 months, or if not longer, then they basically have shown that their body is now set at this area and they've reached their goal. So it allows me as a surgeon to remove more skin if you lose more weight before surgery, and do a more aggressive contouring to the waistline or other areas such as the arms. So if there's a weight loss that's in plan for you, both for your health, which again, of course, we recommend, but also as a surgical way to enhance the shape, then definitely I recommend that you get to the point where you're about 10 to 15 pounds from your ideal body weight, and that we get that BMI around the 35 or lower. That's the ideal situation in order to minimize the risk of complications to patients, both in surgery as well as after surgery as part of the recovery. Well, I hope this session was helpful for those of you who were able to tune in. And again, we hope that you can come in person and experience all the glows, or log on and check out some of the great specials that we have going on this week. And hopefully we'll catch up with each other soon with some more of our educational webinars.